What if the mirror in your bathroom could tell you, like, exactly how your face is going to collapse over the next 10 years?
Right, down to the absolute millimeter.
Yeah, down to the millimeter. And more importantly, what if it told you exactly how to stop it?
That is the big
I
question.
mean, we've all done it, right? You stand in front of the mirror, usually under really harsh lighting, and you just sort of pull the skin on your jawline back a fraction of an inch and wonder about aging.
Oh, totally. Everyone does the mirror pull.
Exactly.
Right.
But usually you just open your phone and immediately get hit with this barrage of, 20-something influencers pushing these trendy serums.
Right, or you walk into a clinic and just have to endure this high-pressure sales pitch for treatments you probably don't even need.
It is exhausting.
It really is. I mean, you are stepping into this incredibly noisy, just super saturated environment.
Yeah.
You go in looking for a simple answer about why you look tired, and suddenly someone is trying to sell you a 12-step topical routine, an aggressive laser package, and basically a completely overhauled lifestyle.
Oh, yeah, the upselling is real.
It is. The signal-to-noise ratio in modern aesthetic and wellness care is completely broken right now.
Okay, let's unpack this, because today's deep dive is all about killing that guesswork.
Yes.
We are looking at this fundamental shift in aesthetic medicine, and it's driven by the clinical philosophy of the Mirelle Institute for Longevity and Regenerative Medicine.
Right, out on the New Jersey shore.
Exactly. And specifically, we are going to explore their flagship assessment platform. It's this piece of technology called AgelessAI, which basically uses cold, hard, structural data to completely map your biology.
What's fascinating here is that this isn't actually a conversation about vanity.
Really?
Yeah, not at its core. I mean, it is really about a structural shift in medical authority.
Okay, how so?
Well, historically, walking into an aesthetics clinic meant you were entirely reliant on the subjective opinion of, whoever happened to be wearing the white coat that day.
For sure, you just kind of hope they know what they're doing.
Right. Consultations have always relied heavily on personal interpretation. It really just comes down to what that specific provider sees or what laser machines they need to pay off that month.
Wow. Yeah, that makes sense. Or whatever happens to be trending on social media.
Exactly.
Because you were sitting in that chair, you're feeling vulnerable, and you are getting this subtle or, honestly, sometimes very overt pressure to proceed with a treatment right then and there.
Yeah, the pressure can be intense.
And you are left wondering, is this truly what my biology needs? Or is this just what has the highest profit margin for them?
Which is a terrifying position for a patient to be in.
It really is. It feels kind of like taking your car to a mechanic.
Oh, that's a good comparison.
Like, something is squeaking under the hood, but when they hand you this massive bill for parts you've literally never heard of, you don't know enough to push back.
Right.
You just have to trust them, and, well, that trust is super easily exploited. Or it's like doing a blindfolded renovation on your own house.
Yep.
You hire a contractor because your roof is leaking, but they keep telling you, actually, you need expensive new siding and Italian marble countertops.
And you just write the check because you don't know any better.
Exactly.
And see, that information gap is exactly where trust goes to die.
Yeah.
And even if the provider is giving phenomenal, clinically sound advice, the whole environment feels so much like a transaction that the patient's guard is just instantly up.
Oh, totally. You feel like you're being sold to, not treated.
Exactly. And AgelessAI was designed specifically to shatter that dynamic.
How does it do that?
It changes the consultation from a process of recommendation to a process of justification.
Okay, explain that.
So the provider is no longer saying, I think you need this. Instead, the AI platform is projecting a multispectral image of your own face on a screen.
Oh, wow.
Yeah, and it's basically saying, here is the exact structural reality of your underlying tissue.
So it takes the subjective salesperson completely out of the equation.
It forces transparency. For the first time, patients aren't just passive consumers of medical opinions,
Right, because you can actually see it.
Yes. When you can physically see the data mapping your own bone resorption or your fat pad migration.
Ugh, fat pad migration sounds so intense.
It happens to all of us. But when you see it, persuasion becomes obsolete. You are looking at the math of your own body.
That is wild.
It transitions the entire experience into educated, patient-led decision-making. Trust is built through objective biology, not just a really charismatic sales pitch.
Here's where it gets really interesting, though, because I have to push back on this just a little bit.
Sure.
The second I hear AI and face in the same sentence, my brain immediately goes to those viral TikTok filters.
Oh, the beauty filters.
Yeah, the ones that blur your pores,
Funny.
instantly snatch your jawline, and make you look like some 20-year-old supermodel.
Oh, great.
It feels like a parlor trick designed to make you feel bad about yourself, so you buy something.
Yeah.
But the Mirelle Institute is incredibly aggressive about stating that this is absolutely not a filter, right?
It is the exact opposite of a filter.
Mm-hmm.
A filter just, manipulates pixels on a two-dimensional image to hide reality. AgelessAI is a real clinical diagnostic tool.
Gotcha.
It evaluates deeply medical metrics. I mean, we are talking about mapping facial structure, calculating volume distribution, and analyzing skin quality, and assessing vascular tone.
Let's actually pause on that vascular tone. That is a real medical metric.
It is.
So that isn't some blurring algorithm. That is the AI looking at the actual blood vessels and the efficiency of the blood flow underneath your skin.
Exactly. When an AI measures vascular tone, it is looking for signs of weakened capillaries or a lack of oxygen reaching the tissue.
Which is what causes that dull look.
Yes. Biologically, that translates to that dull, tired look we all complain about as we age.
Right, right.
It is also measuring volume distribution, meaning it calculates exactly how the fat pads under your skin are slowly sliding downward due to gravity.
So depressing to hear, but yeah.
And it looks at the natural loss of bone density in your skull over time.
Wait, our skulls lose bone density.
They do. As we age, the actual bone structure changes. So it evaluates your actual physiology to establish a hyper-accurate baseline of your physical state today.
And then it predicts the future.
Through advanced modeling, yes.
That is incredible.
It takes your unique baseline and it simulates how different specific medical interventions will alter your long-term outcomes. It provides a blueprint.
A blueprint. I like that word.
Yeah, because a consultation implies two people sharing opinions, right?
Right.
An architectural blueprint is a hard reality showing you exactly what the foundation looks like, how it will degrade, and what specific beams need to be reinforced to keep the structure intact.
Okay, but let me push back here again.
Go for it.
If I go into a clinic because I have like a pesky little wrinkle between my eyebrows, do I really want an AI mapping my face to tell me my vascular tone is failing and my skull is shrinking?
It is a lot to take in.
Right. That sounds terrifying. It sounds like a fast track to an existential crisis, not an empowering medical visit.
I mean, it can definitely be a confronting experience to see the mechanics of your own aging laid bare like that.
Yeah, confronting is a good word for it.
But consider the alternative. Without that structural truth, you just end up throwing money at superficial fixes.
That's true.
You buy a $100 topical cream to fix a wrinkle that is actually being caused by a collapsing fat pad beneath the muscle.
Oh, wow. So the cream isn't going to do anything.
Nothing at all for the root cause. The AI blueprint saves you from the frustration of treating the symptom instead of the disease.
Which means the treatments themselves have to completely change.
Exactly.
If AgelessAI is giving you a deep structural blueprint of a failing foundation, you can't just slap a nice moisturizer on it.
No, you cannot.
And this transitions perfectly into the philosophy of Dr. Karina Ianculovici, who is the founder of the Mirelle Institute.
She is a very fascinating clinical architect.
She really is.
She's a board-certified advanced practice clinician, but what really stands out are her advanced fellowships. She has them in functional, metabolic, and anti-aging medicine.
Right, so she isn't just looking at the epidermis.
Not at all.
She is trained to look at the chemical messengers inside your body, your hormones, your cellular efficiency.
Yeah.
And she actually made a massive pivot with her clinic. She completely rebranded the facility. She changed it from the Mirelle Institute for Anti-Aging Medicine to the Mirelle Institute for Longevity and Regenerative Medicine.
If we connect this to the bigger picture,
Yeah.
that name change represents the entire paradigm shift we were talking about today.
Yeah, it really does.
Think about the term anti-aging. It implies that aging is just a surface event like an aesthetic enemy that you fight from the outside with Botox and fillers. But Dr. Ianculovici's philosophy argues that aging is structural, it's metabolic, and it's cellular.
I was actually thinking about this, and it sort of reminds me of a botanical garden.
Okay, I like where this is going.
So standard anti-aging medicine is basically just hiring a landscaper to come in and prune the dead brown leaves off a dying plant.
Yes.
It looks a little better for a week or two, but the plant is still fundamentally dying.
Exactly.
What AgelessAI and Dr. Ianculovici are doing is digging into the dirt. They are analyzing the soil pH, they are looking at the root structure, and they're basically addressing the microscopic ecosystem.
That is a phenomenal way to understand it.
Thanks.
Because when you shift your perspective from just, chasing youth to what they call intelligent progression.
Intelligent progression, right?
Yeah, the medical toolkit has to evolve. You aren't just filling in a wrinkle anymore. You are trying to engineer resilience and vitality into the tissue itself.
So it can repair its own damage.
Exactly.
And the toolkit Mirelle uses to do this is massive.
It really is.
If you are going to fix the soil and the roots, you need some heavy machinery. They have this huge roster of longevity protocols that honestly sound like science fiction to me.
They do sound a bit futuristic.
Let's actually talk about how some of these work, because they aren't just fancy facials. For example, they utilize something called the Pearl Advanced Cell Signaling Treatment System.
Right. So cell signaling is essentially sending a chemical text message to your biological roots.
A text message to your cells.
Basically, yeah. As we age, our cells get sluggish. They stop producing collagen and elastin at their optimal rates.
Which we all hate.
Right. So cell signaling therapies introduce specific growth factors and exosomes into the tissue to literally command your dormant cells to wake up and start behaving like young, healthy cells again.
That's crazy. So you aren't putting artificial filler into the face. You are tricking the face into creating its own natural volume.
You're reminding it how to do its job.
Wow. And they also list something called subdermal structural suspension, which involves PDO threads.
Yeah.
What is the actual mechanism there? Like, what is the thread?
So PDO threads are medical-grade, dissolvable surgical sutures.
Wait, like stitches?
Exactly like stitches. A provider carefully places them under the skin to physically lift and reposition sagging tissue. They're literally pulling the fat pads back up to where they belong.
Oh, wow. Okay.
But the real magic happens over the next few months. As the body naturally dissolves those threads, the process triggers your fibroblasts to produce a massive amount of collagen along the path of the thread.
So it's healing around it.
Exactly. It leaves behind this biological mesh, a structural scaffolding made entirely of your own tissue.
That is incredible. They are also performing neuromodulation protocols and vampire facelifts, which always sounds so dramatic to me.
It does sound like a horror movie.
Right. But the biology of a vampire facelift is actually incredible. They draw your own blood, they spin it down in a centrifuge to isolate the platelet-rich plasma, the PRP, and then they inject those concentrated growth factors back into your face to signal intense tissue repair.
It is literally using your own biology as the medicine.
Yeah.
But, the Mirelle standard goes even deeper than the face.
Because everything is connected.
Exactly. If you are truly practicing longevity and regenerative medicine, you have to acknowledge that the face is attached to a body. Your cellular health dictates everything.
Which completely explains the other half of their protocol list.
Yes, it does.
The same clinic that is analyzing your facial volume distribution is also offering elite medical weight loss and something called the metabolic code for regenerative joint restoration.
They are mapping the chemical exhaust of your body
to see exactly where systemic inflammation is damaging your joints instead of just handing you a painkiller.
Exactly. And they are also optimizing hormones for both men and women, offering menopause care, IV therapy for cellular micronutrient optimization, and even elite sexual wellness and pelvic restoration.
They really cover everything.
They have to. You cannot have a structurally sound, glowing face if your metabolic system is inflamed, your hormones are depleted, and your cells are starved of micronutrients.
It makes total sense. It is a total multidisciplinary architectural approach to the human body.
It really is.
But, having this incredible comprehensive data map creates a completely new bottleneck, doesn't it?
What do you mean?
Well, you can't just hand an AgelessAI blueprint and a complex hormone panel to a standard esthetician at some strip mall med spa.
Oh, definitely not.
The data is completely useless, maybe even dangerous, if you don't have a clinical architect who actually knows how to read it.
Which is exactly why this level of care remains highly exclusive.
Oh, okay.
Yeah, AgelessAI is intentionally not widely available. Mirelle explicitly restricts this to elite concierge-level longevity clinics that cater to high-profile and celebrity clientele who require, extreme precision and discretion.
And that leads me to a really crucial question for you. We see this pattern all the time with medical technology, right?
Yeah.
It almost always starts with the elite, the celebrities, the athletes, the billionaires who can afford concierge care.
Always.
But eventually, the patents expire, the tech gets cheaper, and it trickles down.
Right.
Do you think this highly tailored, AI-driven, data-first approach will eventually become the standard at every local clinic? Or is this destined to remain a luxury experience for the few?
Well, the technology itself, like the multispectral cameras, the AI algorithms, that will absolutely trickle down and become cheaper over time.
Grayson.
But the Mirelle Institute makes a really compelling argument that the machine is only half the equation.
Right. It's just the tool.
Exactly. Their stated standard is that they, quote, do not sell treatments. We engineer outcomes.
Engineer outcomes.
Yeah, and engineering a cohesive outcome across your joint health, your hormonal balance, your vascular tone, and your facial structure, that requires a highly trained medical architect.
You can't fake that expertise.
No, you can't. You can commoditize the AI software, sure, but you cannot easily scale or commoditize that level of multidisciplinary clinical expertise.
So what does this all mean? If we step back from the glowing AI screens and the medical-grade threads, what is the core takeaway for you, the listener?
It's a big shift.
It is. I think it is that the era of subjective, sales-driven aesthetic treatments is slowly dying.
I agree.
We are entering an age of data-driven, holistic longevity frameworks where your actual biological truth dictates your care, not whatever fleeting cosmetic trend is dominating your social media feed this week.
And this raises an important question about true empowerment in healthcare.
Yeah.
We are so used to being passive participants, just kind of hoping the person in the white coat has our best interests at heart.
Totally. You just sit there and nod.
Right. But when you finally understand your own baseline, when you can physically see the predicted structural changes of your own body, you start making decisions aligned with biology rather than anxiety.
Biology rather than anxiety. I love that.
Transparency removes the fear of the unknown, and it completely disarms the pressure of the clinical sales pitch.
That's incredibly powerful. But I do want to leave you, the listener, with one final lingering thought.
Okay.
Something that isn't explicitly stated in the source material, but is absolutely born from it.
I'm curious.
If artificial intelligence can now give us a perfectly accurate structural blueprint of exactly how our face and body will age,
Right.
like calculating the exact rate our bones will shrink and our vascular tone will fail,
Yeah.
does seeing that definitive map of your future self actually bring you comfort and empowerment? Or does removing all the guesswork from our own biological decay introduce an entirely new kind of psychological weight?
Ooh, that is heavy.
Knowing exactly how your foundation will settle before it even happens might be the ultimate medical advantage, but it forces you to confront your own mortality in high definition.
It really does.
It is definitely something for you to ponder the next time you lean in close to that bathroom mirror. Thank you so much for joining us on this deep dive. Stay curious, and we will catch you next time.